And while looking into the discussion happening in the chat, I noticed there's one question, and this topic was not actually that developed during today's webinar. So there's a patient asking, what is the role of eosinophils in urticaria? Could you please tell us a little bit more about it?
I'll go first.
Sure.
Some people say that urticaria is asthma of the skin. I don't believe that. There are similarities between the two. Mast cells certainly have something to do with both of these diseases. But we do see that some of the medication that works in chronic urticaria also helps asthma people. Why? Because similar mechanisms, similar drivers are in play. Omalizumab, for example, is a very nice asthma drug. It was first an asthma drug, and it is a very nice drug for chronic urticaria. It's probably better for chronic urticaria than for asthma. But in any case, if you have a patient who has asthma and chronic urticaria, well, here's your chance to help both of these diseases with one medication. There are not many pills for asthma. No, sometimes we use leukotriene antagonist and sometimes antihistamines, but this is not the mainstay of asthma treatment. So I think the only overlap that we see is omalizumab anti-IgE that works in both asthma and in chronic urticaria.
Perfect.
I don't know if I...
Yes, please.
I would like to add a little bit to that. Well, we have here in Mexico City, we have almost pollen going around all year long, you know, because we have really spring all year long. But there's one or two trees who really have this very high peak of pollen just during December and January. Our spring season, pollenistically speaking, is December, January. That's ash. And then, well, I have some patients who really get bad allergic rhinitis and asthma during the ash pollen season, and some of them get hives together with that. So this is one of the very rare cases where you see there does seem to be a cause here of IRA allergen that causes the hives to rise. And those patients do much better when we treat them with allergen immunotherapy. But it's really only when they have also these respiratory diseases added to them. And here, surely, if asthma is allergic asthma, then allergen immunotherapy can be a very good add-on therapy.
Thank you very much. I see still some questions regarding nutrition and food allergy, food intolerance appearing. So Désirée, since you already started elaborating a little bit more, there's a question about specific gluten sensitivity, and can it be somehow related and induce urticaria?
Yeah, it's a very good question. It's specifically a very popular question. Now, I think gluten allergy is so much going around in the web and all over the media. However, real gluten allergy is very rare, very rare. I have had several patients, just one yesterday, who came in with hives and who thought she was allergic to gluten. So it's really very popular. People think it is like that. We had a very good interrogation, and it was the thing that she was taking NSAIDs. Now she was taking, I think it was naproxeno, quite often because of, well, certain pains that she had. So that was probably the cause of her hives, nothing to do with gluten. But it is really very, very popular. It is very, very rare to see this is really the case. Even, I might say, I've not seen one patient who had gluten allergy being the cause of urticaria. I've seen maybe 2 or 3 who had trigo, wheat allergy. And that was the case of their allergy, but then they really would eat something and the hives will break out immediately. Now there's really, if food is the cause, then there's this direct relation between eating the foods and getting the hives. And it is every time you eat the food. No, not sometimes yes, and sometimes no. No, because then it's not the food causing the hives. I don't know if other panelists would like to add something to it.
I think it's right. In general, we advise the patient, if they're really strongly suspicious of a certain thing, we say, okay, avoid this food for a few days. If it's urticaria, if it's related to that, you no longer have it. But if it's not related, you'll still get it. And the majority would still get the urticaria, I'm convinced.
Thank you very much for your question. And now I see quite a lot of interest of our patients. What is happening in the field of drug research, and are there any medicine being developed currently to maybe possibly bring more better results? So if you please could update us with what's happening in the scientific field, we would really appreciate it.
What do we do? Rock, scissors, paper? Let me start, okay? This is one of my... Sure. Look, we have 4 ways to help patients with urticaria. We can block mast cells mediators. We can block mast cell activation. And we're doing this. And there are a couple of new treatments under development. We can also silence mast cells. No, we can put them to sleep, inhibit them. This is a new approach called lirentelimab, now in clinical trials. And we can take mast cells out of the human body. Yes, we can do that. No, so we can deplete them with a drug called CDX-0159. But most drugs that are currently being developed are focused on mast cells. How can we stop their activation? How can we stop their mediators? I think here in Berlin, we have 8 or 9 clinical studies right now in chronic urticaria, all different approaches. So check whether you live close to a study center that you can participate in a study and help develop, well, help yourself and help develop better medications for patients with chronic urticaria.
Perfect. Thank you very much. And I see that time actually is running out super quickly. I want to thank sincerely all of our panelists for being here today, for sharing your expertise. I'm pretty sure it was an enriching experience for everyone taking part in today's webinar. And for all of our participants, I just want to remind you once again to scan this QR code and connect with us on your favorite social media platforms. Don't forget to follow up and follow our news on the upcoming UCARE webinars. And the recording of this webinar will be available on our YouTube channel as well as UCARE website. And this will also be translated into different languages. So be sure to check it out a little bit later. I want to thank you sincerely for your time, everyone. I want to thank once again Novartis for making this event happen. And I wish you a very good day and hope to see you soon.
Thanks, Aistė. Be well, everyone.
Thank you. Thank you, Aistė. Thank you, thank you. Big hugs to all. Take care. Bye-bye.
Bye-bye.
Take care. Bye-bye.